supporting you in your dog parenting journey. The Dynamic Dog Owner with Debbie Potter. Hello and welcome to this week's episode of The Dynamic Dog Owner, the podcast designed to support you, the dog parent, in your dog parenting journey. We are joined by a guest today, which is very exciting. Anna Balch, who is a dog training behaviour specialist in reactivity, who is based in Berkshire, so not too far from us. Hello, Anna, and welcome.
Hello.
So,
hi, thanks for having me.
Absolute pleasure. Always nice to have a conversation. I mean, I'm sure the listeners get bored of my voice after a while, to be perfectly honest. So it's always nice to have a fresh voice to listen to. So what we're going to be talking about today, we like to have a topic. So we're going to be talking about how sort of behaviours, whether it be reactivity or other behaviours, can be linked to things like pain, and how behaviour and pain are linked, which, I don't know about you, but I always think when you mention the word pain, it kind of feels like dogs are in like agonising pain. It's a bit different, isn't it? But yeah, so let's get started. Yeah. First of all, obviously people may not have heard of you before. So do you want to tell us a little about you, your background, how you got into dog training, what you do, all of that stuff?
Yeah, absolutely. So I've been working in the training and behaviour kind of sector, as you would say it, for around kind of 10 plus years, just over 10 years now. I was trying to figure out how long it was, and it feels like a long time. But generally we cover everything from puppy training to like older dog training. But our kind of speciality, if you want to call it that, is working with reactive dogs. And normally that's fear reactive dogs, so dogs who are scared of the world around them, normally other dogs, people, noises, all that kind of stuff. And I think the kind of pain element of that is so closely linked to those sorts of behaviours, though there's a really interesting link that we're seeing all the time now between kind of pain and health issues and other training things as well, such as like pulling on the lead and just being a bit fizzy and a bit wired. So most of the time, most of our clients come through and they get some sort of health related kind of inspection from us. Obviously we can't diagnose anything, but we're able to have a look and see if there's anything that might be needed to be picked up to be taken to the vets that might be contributing or even causing the behaviour that the dog is going through. So I've got a small team, we are Berkshire based, as you say, and we take on pretty much everything. That's our kind of stuff that gets us excited.
You sound similar to us. We're kind of the same. We're very similar in terms of what we do, and that we do a lot of reactivity as well. We're just a neighbouring county, which is quite nice. So
I know.
I don't know about you, but do you find with the clients you see that there is a definite rise in reactivity cases?
Yeah, I think so. And it's funny because I kind of joined the like other kind of trainers and behaviourists that I've seen that are debating why this is happening. And I think there are lots of reasons, but I do think health issues have a big part to play in it and the way that our dogs are bred. And I think potentially that's and this by the way is just me and my experience talking. There's no research behind it necessarily, but from what I've seen, especially through COVID, a lot more people started to kind of breed from their dogs, from their pet dogs, and I think the breeds that we have are so specific in terms of the health issues that they tend to come along with. So I'm starting to see dogs that are bred from dogs with health issues that then have health issues, and then they get bred and they pass on their health issues. And I think that potentially has one impact on the amount of kind of reactivity in dogs with behaviour issues that we're seeing, because a lot of them, I would say out of all of the dogs that we see, 95% of them have some sort of health issue that is contributing to their behaviour. So it's a huge link for us in terms of the people that we,
definitely.
And I think that most of those dogs will have had their health issue from day one, from a breeding related point of view, rather than they've had an accident or they've fallen off the stairs or something like that. Is normally they have been like that since pup, and it's a hereditary breeding situation.
Yeah, no, absolutely. I would agree with. There's always something, it's a bit like people, let's face it, there's always something, everyone's got, I don't know, like a dodgy shoulder or a dodgy knee or a gut imbalance or what have you. We're the same. I think maybe as we are developing, we tend to see now dogs as more of a being rather than just they're a dog, and understanding that the things that we can have wrong with us, they're the same, but we don't, it's not the norm to have, well, yes, my dog has a chiropractor. People go, what? What do you mean your dog has a chiropractor? It's like, well, of course he does.
Absolutely.
That's quite a
modern
and I think phrase to hear.
Yeah, absolutely. And I think we expect so much more from our dogs now as well, right? So, our dogs are coming running with us and doing agility and, doing training and coming for walks with us and all that kind of stuff. And if you think about it, not that long ago, most dogs lived outside and they potted around in the garden and, got thrown scraps on the table. and so our dogs are so much more a part of our kind of everyday lives at the moment. And I think even things, even the way that the dog's diet has changed and the way that we feed them has changed. And I think that has a big impact on how they navigate our human everyday lives.
Definitely.
And we need to start thinking about them more as how they cope with stuff, both from a internal how they feel perspective, but also obviously what we throw at them at the same time.
Definitely. I think you can definitely see shifts in sort of how things change, because as you say, they used to get thrown scraps off the table. It used to be the norm that you just open the door and the dog would go off for the day and come back when they were hungry at the end of the day. Whereas now everything is more controlled. They've got to be on a lead. I always feel like we've kind of limited their world quite a lot. And then naturally wonder why we see unwanted behaviours, quite simply.
Completely agree.
When we talk about, let's talk about the pain, the word pain. I think, I don't know about you, but I think it automatically kind of makes you think of severe pain. They are, struggling. They are like agonizing pain. It's a much more broad topic.
Absolutely. And I hardly ever get any dogs really that are in agonizing pain. I've probably within, I'd say last year, I maybe had 3 dogs that were severe enough to warrant surgery, but that was it. So most of the dogs it will be small things like, a pulled muscle or a way that they're moving that's just causing them a bit of discomfort in their back. We have back pain. I mean, name me a human that doesn't have back pain, right? Pretty much everybody has
at
back
some
pain
point,
somewhere along the line. And that doesn't mean we've got something horrifically wrong with us. Our leg isn't falling off, but the back pain is just a process of how we've held ourselves, how we walk, the stress that we feel, all that kind of stuff. And in my experience, that's very similar for our dogs. Dental pain, for example, it could be that they've got just one like niggly tooth at the back of their mouth that's just causing, and if anybody, again, human-wise, has experienced dental pain, it's pretty horrible, and it has a massive impact.
Of course it does,
But unfortunately, obviously with our dogs, we can't see it as clearly and they can't tell us, but it can be something really, really tiny like that. And I think thinking about it more, it's not just the muscles and the bones. Tummy pain is another one. Again,
unhealthy
if there's
guts.
a human you've ever had IBS, all that, just having a funny tummy and just feeling tense in that area can have a massive impact on how you experience the world around you and how you generally cope. So not a lot of the cases that we work with, like I say, have anything hugely bad. It will be a small niggle or a bit of deterioration in the elbow. It'll be something along those lines that's just chronic enough and just everyday niggling in the background.
And they're so
just
small,
enough for our dogs to kind of go up.
And they're so small that people wouldn't realise. We don't see.
Absolutely.
They don't limp. They don't have terrible tummies every day. They're not being sick. There's not anything obvious that you'd go, my dog is unwell and needs a vet. They're just subtle enough that we can't spot them, but also subtle enough to cause a problem. And that's where you get that awkward bit, isn't it?
It's really awkward, and I think one of the challenges is being able to see that as a human. But on top of that, it's the way that our dogs are able to mask that pain really well.
Absolutely.
And I always say that they do it better than us, but I'm not sure that necessarily is the case. My husband won't mind me talking about him, but he's a runner. and he has a niggly Achilles, you know, all the time. It's just a niggle, and it bothers him, but he'll still go out running. So I think we do it as humans as well. You know, we have bad backs, but we'll still do loads of lifting, and then we'll end up hurting ourselves, you know, at the end of the day and worrying and saying that our back hurts. So as living beings, we're born and bred to kind of work through our pain, because that's the way we survive and do things.
And so it's a very soldier on, isn't it, as well?
Pain, they're going to stop. Yeah, absolutely. You kind of need to, right? And if you're in the wild and you stopped because you had a little bit of an ache, you'd get eaten or, you know, killed by something. So you need to keep moving.
Of course.
So I think, you know, the way our dogs plow through and keep going is not necessarily a reflection of how they're truly feeling underneath. And that can be a difficult thing to kind of understand.
And as we know, you know, if you're feeling a little bit you know, sensitive, if something's hurting, we carry on, but it affects our mood, it affects our tolerance. We can be a little bit more short-tempered with people, you know, and I'll have my hands up if I'm feeling unwell. I'm like, you know, we do it.
Yes, we do.
It's just we understand, because we're people, and we can say, oh, I'm really sorry, I was a bit of a miserable what's it earlier because my back's hurting. We can then justify it, but our dogs can never do that. Or the way they do it is through the subtle changes in behaviour that we assume is naughty behaviour, when actually it's a reflection on something else. So how do you, I mean, one of the things... absolutely. You carry on. I was going to say, one of the things...
I was going to say, I always use... Good.
Talking kind of like trainer to trainer, I don't know about, obviously, I know the podcast is designed for dog owners to listen to, but I think one of the biggest things from my perspective as a trainer is getting the message across to people and saying, you know, there could be something wrong effectively with your dog, without them panicking and going, oh my goodness, my dog's, you know, terribly in pain. But then also kind of making them see that it's important to investigate to help actually solve these troubles you're having. That's, for me, I don't know if it's the same for you, one of the hardest things, to get that balance of not, you know, putting the fear of God into people that their dog's unwell, but also making it important enough that it's something that needs to be addressed to help their overall behaviour.
Yeah, absolutely. And I think so much of that is about how we like present it to our owners in a way that helps them to feel like it's something that they can do something about. I think some of that fear comes from it being big and I won't be able to help it, or it'll be massively expensive, or put my dog in, you know, I'm gonna have to put into surgery and all this kind of stuff. And actually, I think if you can come at it from it doesn't have to be something big, and there are lots of really small, easy changes that we can make to help the dog feel more comfortable. That feels more, I think, accessible for people, and it feels like they can make a big difference in their dog's lives. So what I try and do is kind of say things like, you know, if your dog, say, has hip dysplasia, is not necessarily going to need surgery, but actually just putting some rugs down on your slippery floor will make them feel, you know, 100% better. Just not slipping around on your floor will make them feel so much better in their household. And that's something that's really easy and accessible for most people to be able to do. And I think small changes like that, and understanding that there's tweaks that can be done, puts my owners' minds at rest to say, right, there is this problem. And then there's the sense of relief, actually, because a lot of people I think that I work with are at their wits' ends with their dog's behaviour, and they've tried everything, and they've done training, and they've thrown everything at it, and it's still not working. Sometimes presenting health issues as the thing that is the one thing that's going to get them to that next step, and they go, oh great, okay, it's nothing I'm doing wrong, it's actually I just need to address this. So I think putting that kind of more positive spin on it, to say it's something that we can help, and it will therefore help you and your dog back, tends to, I think, help have that conversation, if that makes sense.
Definitely, because we do, you know, everyone, even as dog trainers, we blame ourselves. You know, we always go, it's something I've done wrong, or I didn't do enough when they were young, or I haven't done this. And sometimes knowing that it's actually, I always say it's like a multi-pronged approach. It's not just training, it's not just behaviour, it's all of the factors that, you know, their daily life, you know, their diet, their muscles, everything that all comes together. We have to work on every single angle to get into the root cause of the problem.
I was just going to say, there's no point in hammering in on some sort of training if, you know, something else is causing it, right? And that's what I completely agree. That's where that bigger picture is so important, because actually, if you've got a dog that's pulling on the lead because it's more comfortable for them to walk faster because of something that's hurting them, then you can do all the lead training in the world. You can do it till your face goes blue. But actually, if you're not addressing why they're trying to walk fast in the first place, then you're never going to get there. So you're completely right. I think looking at that bigger picture is super important.
Definitely. And I think also it's the subtle things as well, like, you know, sometimes it's harness choice. You know, if they've got a sore muscle and that harness is sitting just on that bit that's sore, they then start having an aversion to the harness. We then say, oh, my dog, you know, hates wearing a harness. They pull more in the harness because actually it just causes a little bit of discomfort, and it's the design that is sitting wrong, or, you know, they need that muscle released, that then again has this massive impact. So it is the small things.
Absolutely.
What kind of behaviours do you see commonly that are affected or influenced significantly by pain? Obviously, we mentioned pulling on the lead, we've mentioned a bit of reactivity. Anything else that you kind of see on a regular basis?
God, the list is really long. From a so you're so ready. So from a kind of, just if I call them kind of general training projects, most of that is things like we call it kind of fizziness. Dogs that just seem a little bit extra difficult. They just don't know how to settle. They're on the go all the time. They're a bit mouthy. They're a bit jumpy uppy. All the stuff that makes you just feel like, my dog should be more chill than this. It's those sorts of things tend to be the kind of low level. Something's bothering them, but they just can't deal with it, and that's what kind of comes out as. And then the behavior, what we call our behavior cases, normally kind of our most common things, sound sensitivity is a really big one. Obviously reactivity in general, in terms of barking, being fearful of people. And sometimes, for example, the being fearful of people and dogs is because dogs and people have touched them in the past and it's hurt. So then they start to have that association that actually, if a big dog jumps on me, that hurts. I don't like big dogs. I want them to stay away. But there's some really interesting ones as well. So we get dogs who, for example, growl when they're trying to be moved at night. So if they've been asleep for a while and then you try and take them out for their final wee and they don't want to go, or they start growling. Dogs who obviously have like an aversion to touch in general, not being able to be groomed properly. You know, so anything that involves kind of affecting their body and getting them to move and touching them is obviously. And for obvious reasons, right? If your body feels horrible, the last thing you want is somebody trying to move you or touch you or stroke you. You don't want to be touched. So we get a lot of that side of things as well. And then one of the really interesting things I think a lot of people miss is dogs not being able to travel in the car. So we've got a big link with pain and car travel. So drooling, pacing, not being able to settle. Because at the end of the day, if you're in the car and the car is moving around and you can't stabilize yourself and that's painful, then the car's going to be, you know, an aversive and really kind of scary thing for you to manage on a daily basis. So car travel is a big one that a lot of people miss.
Definitely. And car travel is quite a common, you know, complaint. I mean, and I always think it's one of those like chicken and egg situations sometimes. One of my dogs was car sick for the first kind of 8 months of his life, and he hates going in the car. And it's kind of like, do you hate going in the car because you felt sick, or is it the other way around? What?
Of course.
First. And he tolerates it now, you know. But he's quite a sensitive soul anyway. He's like, oh, it makes noises. Getting in it's not very nice. Once he's in it, he's fine. And settles down and goes to sleep. But you kind of go, is it because you had a sore gut that made you sick? Are you anxious because you were sick? How did all of this come about? But it's really common. We see it a lot with puppies, especially. And obviously, you know, I think with puppies, it's they're still growing, aren't they, and getting used to their body and time and space and where it is, and being in a car with the imbalance of movement. There's so much of a sensory overload in the car anyway. And as you say, if you're in a little bit of pain, jumping in and out can be painful. Not wanting to do that. Then you've got the ramp being scary if you have a ramp instead. It seems like the most simple thing in the world, just pop your dog in the car. But actually, there's a whole host of things that go on.
No, absolutely.
Just to get them in the car. So it could be a challenge. And say you tend to always think they're just being naughty, they're just being awkward, when generally.
Yeah, yeah.
There's something else
And
happening.
yeah, there's something else going on. Yeah, sure. And I think we get the whole, my dog can't be in pain because, you know, they always want to go for a walk and they always want to jump up and down, and, you know, they always run around like crazies and all that kind of stuff. And I think that's probably the biggest challenge, is getting people to understand that dogs won't stop doing those things, even though they're in pain. They will continue unless their leg is falling off. And even then, I've known dogs to just keep going. They probably can't use them, but they'll still go. So, you know, a little niggly bit of hip dysplasia, for example, will not stop them running around like an idiot for, you know, hours and hours on end. But then what happens is they get in the car and they hurt, and then they associate the car with the hurt, and then they don't want to get in the car. So yeah, you're right. It's not always the simplest kind of, there's lots of things that kind of go into it, but pain and health needs to be a part of that conversation, because, you know, there's a chance that that's having an impact on everything else that's going on for that dog.
Definitely. And I say, I'm sure you've seen it firsthand. I've seen it firsthand with one of my dogs, that, you know, it's so subtle, it grows and grows, and you suddenly go, oh man, you're actually in pain, I hadn't noticed. I'll hold my hands up. I did it with my oldest dog last year. And I was like, actually it was the year before last, gosh. And it wasn't until he was really bad, and I was like, oh gosh, have I missed something here? Because you were doing everything. And then all of a sudden I was like, actually my back's killing me. Okay, sorry about that, I missed it. And you feel terrible. But you know, and then you're on the back foot trying to fix it. So I mean, he's loving it. He gets to therapy all the time. He thinks it's the best thing ever. So he's well happy. But you know, it's so easy to miss. It's so easy to miss those subtle signs.
Yeah, it really is. And I think that's the difference between acute and chronic pain, right? Chronic pain is so interesting in the way that it does just bubble along under the surface, and it's just the tiny niggle things every day that just build and build and build. So it's not something really obvious. You don't see it, but over time it grows. And I'm the same. I now I know what I know. I look back on videos of like my old dogs and I'm like, oh no, I there's totally signs there. Completely missed them.
Totally.
You know, and now I can't not see things, but yeah, back in the day I was like, yeah, I can see it now. And I just, and that's fine. We can't see everything.
Exactly. And I always say, you know, you only work with the information you know at the time, because a lot of people will feel guilty. Like, you know, you've just highlighted yourself. You did go, if only I knew. Dog owners, you know, general dog owners who haven't got the knowledge or the experience that, you know, we have, they're going to feel terrible about it. But you only know what you know. You can't, you know, in hindsight, lovely, but you only can work with the information you've got at the time. And obviously that's why people like you and I are here, to point out these little things to help. And then obviously they've got the knowledge to then pass on to someone else, potentially go, oh, have you considered, my trainer said, and then can help them out further.
Yeah, absolutely. And you know, my so you good?
No, go for it.
My clients my clients are do exactly that, and they say, oh my gosh, my dog's, you know, been broken for years and I didn't know anything about it, and I'm really worried that they've been in pain all this time. And same as you've just said, you know, how would you ever know that was the case unless you've done this training? There's no way to notice it, and there's nothing wrong with that. I think what they've done brilliantly is they've reached out for help and gone, something's not right here, you know, and ask somebody who knows. And that's all you can, as I know, that's all you can really do. And that's, you know, the same for anything. Just go and ask for help and find someone who can.
Yeah, absolutely. So when you obviously you might mention something different that I wouldn't mention, so it's always good for me to have a potential new thing to talk about as well. What kind of things do you point people in the right direction of? So if you've highlighted there might be something, do you have like your go-to service or type of treatment or person that you would recommend?
Yes, we do. So we've built some really good relationships in this local area for people that can help. And you know, the other level of this is that there's not just one fix for something either. It's not just, right, let's go to a physio and get things sorted. So even then it takes a team of people to understand, you know, the right thing for that dog, and depending on what's going on. So obviously our first thing is to refer back to the vet and make sure that everything gets ticked off by them and they're happy with, you know, we get the diagnosis and we're happy with the referral from the vets to get the client to some sort of specialist. And most of the time, hydro and physio for us are kind of two go-to. So we've got two really good teams that we send our dogs to. But we can also work with things like laser therapy, chiropractor. We've got acupuncturists as well that we can send our dogs to. So depending on what we think, or the vet thinks what we think, and what the other team specialists think the dog might need, we've got, you know, people that we can send our clients to, which is really nice to have that kind of support for them there, because again, you know, not many people are very familiar with having a chiropractor for a dog, right? So it kind of opens up this whole new world. I've also got a lady who does absolutely. And we've also got a lady who does herbal self-selection or zoopharmacognosy, which is really fascinating. Nice. So it for those of people who don't know, it enables our dogs to choose the kind of herbs, plants, the natural remedies that they would normally choose if they were, you know, out in the street and out in the wild, that they don't get access to anymore. So they can choose. And for example, I just did it with my new dog the other day, and he was able to choose things for his gut. And then once he'd finished with those, he chose things for his pain. And then he went and he laid down and fell asleep and processed
Amazing.
it. So there are so many different options. It's not just about going to get surgery. There's so many things out there that nowadays, thankfully, we can do to help our dogs, which is great.
And I think, again, that's where we always think pain, go to the vet. Well, the vet said there was nothing wrong with them. But obviously every service looks at it from their own set of eyes, their own lens, and sees it from that point of view. And, you know, obviously vets are brilliant at what they do in terms of surgeries and the big stuff. But there are so many subtle things that have a massive impact. I mean, one thing obviously you didn't mention, and most people wouldn't mention this one, is my dog has a cranial osteopath, if I can say it, because and I'm like, who even knew that was a thing, you know? Why would you give that to a dog? But it's magic, like amazing. And I know when he needs another treatment, because I go, oh, you're being a little bit of a challenge, you need to go back and have that done again, a little bit of head squeezing, and then he's happy again. He's a very weird dog, but but there's so many things out there, and it's knowing them, isn't it, and finding them, and then knowing how to access them more than anything.
Absolutely. And you know, I think I've learned quite a lot from myself as well in terms of the human side of things, because again, you know, doctors are lovely and they're really great at what they do, but it's a really small part of course it is. Your health and well-being. You know, not a lot of GPs, for example, will know about nutrition, and actually if you've got inflammation in your gut, that's going to have an impact on your body, so you go and see this person for that. And I think opening up our world to the people that are out there that can help both us and our dogs from a health perspective, the bigger the picture, the better, and the better success you're going to get with that sort of help, really. And that's not saying that one person does a bad job. That's not the case. It's just that they've got a different role within you know, the health system that's either fits in alongside somebody else, or, you know, isn't.
And they all fit in together.
Dog.
They all complement. It's a bit like us, you know, we look at it from a multi-pronged approach in terms of training. It's just a multi-pronged healthcare for your dog, isn't it? And of course, you know, I mean, one thing, again, I don't know if you've ever come across this. I had it done for my dog, and then my daughter, and then myself, is hair mineral sample testing. Absolutely epic. I was amazed. All I told them was Labrador, 4 years old, not neutered. And they were like, this dog is going to be doing this, and this. And I was like, yep, he does all of those things. And then his nutrition plan just went ping. And I was like, that is incredible. And it reset everything. But obviously, I was going to say, now, obviously, I think one of the things, obviously, that we're mentioning, all these wonderful treatments that you can have, all these wonderful things you can go to, the cost, obviously, always has to be mentioned, let's face it. Because it's not cheap to investigate all these things, is it?
No.
Sadly.
No, it's not. And no, sadly, it's not. And I think this is where two things, really. One is that if we can help owners to go to the right person first, that prevents them from spending money in places they don't need to spend money. So it's a faster approach, and it will get them kind of faster results, and it's more efficient. But also, if you don't have the money still, these kind of lovely fandangled things, I think, like I said before, the small, I think just knowing about what your dog needs, the amount of changes my owners then automatically make that are completely free. So, for example, getting a ramp for their car, so, you know, stopping their dog jumping in and out of the car, getting rugs for their floor, you know, learning how to do some basic massage at home from, you know, an online course to just help them relax, you know, making sure they've got choice of beds at home so they can choose which one feels more comfortable for them. you know, I've gone from people who have gone, right, I run my dog for like 2 hours a day, to no, we don't run anymore. Because running is bad for them. So there are so many free things that we can change to help our dogs feel better as well, just by knowing what they're dealing with and what we can then do to help them feel
absolutely, just those small life adjustments. And if we'd do it, you know, I always remember when I went to a chiropractor, they told me to sit up straight, which if you're watching this on YouTube, you'll see I am not. You are demonstrating it beautifully. I could do that and it would make my back better. I obviously make the choice not to. Our dogs don't know any better, but we can make subtle choices. As you say, it's just like changing the food, adding the occasional supplement, making these really small things that can actually have such an impact without having to spend loads of money, just to see if it helps more than anything.
Yeah, absolutely. And I think the way that our people treat our dogs their dogs as well, in terms of, you know, when they don't understand why their dog doesn't want to be stroked, it's really hard. But actually, once they understand that their dog doesn't want to be stroked because they're hurting, they suddenly are much more hands off. And even that can have a huge impact in our dog's behaviour, because the dog goes, oh, thank you, you're not touching me anymore. That's exactly. I feel so much better. And it changes their relationship with their dog.
Totally. I mean, I've got a first case example of that. And obviously, if people have listened, if obviously people who might be seeing you on here might go, oh, Anna's on the podcast, I'll listen this week. They might not know like all the thousands of episodes, or hundreds of episodes we've got before. One of my dogs, my eldest dog, hated being touched. And I always, you know, again, he's my first puppy. He kind of joined me at the very beginning of my training journey. So I've kind of grown with him. And he hated being touched. Yeah, I just thought, we always went, he's just a bit antisocial. He's not a cuddly boy. He likes his own space. He just doesn't really like being touched. And we just accepted that was him. And then when he got a little bit, and he couldn't get him to a chiropractor or anyone like that, because he was like, oh, don't touch me. And I couldn't find the right person to work with him. Once he started having his treatment, all of a sudden he's like, you can touch me. You can cuddle me, you can groom me. And I was like, oh my God, I feel so terrible, because I just thought you were an antisocial bugger. When actually, you were like, Mum, it's a bit sore. Now he's comfortable. He snuggles up on the sofa, and it's like he's transformed. And again, I go, God, if only I had looked at that sooner and not realised that you weren't just grumpy. It changed our lives as his family, because now he does want to interact with us, he does want to cuddle us, and it's lovely that he now does, but then equally feel terribly guilty that he didn't at the beginning, and I just thought I misread the room, which is so easy to do, isn't it? So easy to do.
Yeah, it is, of course it is. Yeah, we can't know everything.
We all do it, and I think, you know, I don't know about you, but sometimes people assume that because we know what we're doing, supposedly most of the time, that, you know, we never make mistakes, but we totally do. I don't know about you, but I just own them and go, I made a mistake, and I'll learn from it, and I can teach other people about the mistakes I make that helps them. Yeah,
of course. And I'm like I say, it's good to make mistakes, because then we go, oh, by the way, guys, I did this, don't do that.
Don't do it. Yeah, exactly.
It didn't work. And now I know that it's not. And through that, I met this person who can help me with this. So now I can send you to this person that will help you with this as well. So, you know, the more almost we get wrong, the better, because the more that we learn. But also, you know, we have to remember that our dogs are living beings. And it might be that actually for the first 3 years of their life, they were happy with being touched, and then they changed. And that, you know, they're changing all the time in front of us. If I just use one of my boys as an example, as soon as his arthritis got bad, he completely changed. Like where he wanted to sleep was changed, how he wanted to be touched changed, his relationship with his harness changed. So I had to really quickly kind of learn and adapt to his new way of doing things. So I was getting things wrong with him all the time, because actually what I used to do was not what he needed now. And that kind of changed over the space of like 6 months. And I was constantly needing to go, oh, hang on a minute, do you like this now? You don't like this now? Okay. And then we had to just tweak and change things as we went. So, you know, even if we try and get everything right all the time, our dogs are beings that can't talk to us and needing different things at different times. So we're going to get it wrong at some point. And, you know, that's okay. I think as long as we keep questioning and we keep re-looking at it and we keep going, actually, are you being difficult, or is there a good reason for this? The questions we just need to keep asking ourselves, and learning as we go.
And I think that is very much, I mean, that's why we're called the dynamic dog owner, but you know, we change. situations change, people change, dogs change, and the fact that I think the thing is being open to the change, isn't it? And not realizing, well, I've always used this equipment, I've always used this food. Sometimes it has to change. You know, as dogs age, their nutrition needs change, their choice of bed changes, everything can change. So I think that's the most important thing, is to continue changing and growing for the dog that you have in front of you, and not always just sticking to one thing. I've had to change one of my dog's food recently, and I'm like, this is so inconvenient. But he's much happier. I'm like, oh, it's just awkward now to buy 2 lots of food. But he's happier, his gut is happier. From my point of view, really annoying. But we have to change and develop, and it's so easy to stick in your ways, isn't it? And see something from one point of view. But changing is important, and it's really beneficial.
Yeah, definitely.
Cool. So we've had a good long chat, which is amazing. Any sort of final things you would like to mention that we haven't mentioned already?
I don't think so, to be honest with you. I think just a general message to people is that, you know, have the confidence to reach out. And if you, basically, most of the time, my clients' instincts are correct. Most of the time, they'll go, there's just something not quite right. And normally that's the reason why you pick up the phone and ring a trainer in the first place, because you go, I've tried this by myself and it's just not working. What am I missing here? So I guess if you are at that stage with your dog's life and you go, I think there might be something wrong, or, you know, I think there's something a bit off, or I think this is more difficult than it needs to be, then just pick up the phone, because the chances are your instincts are right, and there's probably a really simple and really lovely solution to that, you know, people like us can help with. Don't feel like you have to sit and suffer and plow through it. It's really hard.
And I think, I don't know about you, but that's one of the feedback we get an awful lot, is that you just made it feel so simple. You just did this one thing and it's transformed, because our aim is always to give you the easiest, quickest result possible with minimal impact. But obviously, having the knowledge of seeing hundreds of dogs, we've tested it. We've seen similar cases. We've tried things. We know what might be needed in your situation. And there's no harm in asking for help.
Yeah, absolutely. And especially with the pain thing, because the likelihood of owners being able to know what it is and to be able to see it themselves is slim to none. So call somebody who does, you'll be able to get to the bottom of it.
Definitely. So as we mentioned earlier, obviously you are based sort of Berkshire way. So anyone listening who is that way, who needs some help and support, then contact Anna. What's the best way to contact you if they would like to get in touch?
Any email, WhatsApp, phone. I'm open to all, so just whatever's easiest.
Cool.
Pick up the phone or whatever, and get in contact with us. We'll be on the other end of the phone, ready to help. So yeah, however's easiest for everybody is all good.
Amazing. I will pop a link to your website in the description of the podcast so that anyone listening can find that straight away. Thank you so much for joining us. Really good, interesting conversation, which is always good.
Thanks. Yeah. No, it's been great. Thanks for having me again.
Pleasure. And we will catch up with all the listeners again next week. Have a lovely week. If you love listening to the podcast, why not check out the Pawcademy for practical dog training advice and how-to videos. The hub is broken down into sections, and hundreds of pre-recorded videos are there for you to start watching whenever you choose. You can watch them back as many times as you like. You also get to talk to other community members and discuss your training, and benefit from live Q&As with myself where you can get your questions answered. Why not make use of our 3-day free trial where you can access all of the content on the hub absolutely free for 3 days. The link is in the description below, so do check that out. And I can't wait to see you in the hub. Thank you for listening to The Dynamic Dog Owner with me, Debbie Potter. See you next time.